to the Thom Hartmann Program.
Well, word has it that the Senate Finance Committee, Max Baucus's committee, is going to trash the public option, is going to do away with the requirement that employers provide health care. And there's dozens of rumors flying around. We still haven't seen a bill yet. But, where is all this going? At the same time, this is mind-boggling. This article over at Huffington Post, key GOP senators soak up thousands at health-specific fundraiser is the headline. Top Republican senators involved in crafting health care reform legislation participated in a health care-specific fundraiser Monday night. Guests were asked to give a $2,000 contribution to the National Republican Senatorial Committee to attend a, quote, roundtable on health care issues, and $5,000 for both the roundtable and a dinner with Chuck Grassley, Mike Enzi, and Richard Burr, the Republicans from Iowa, Wyoming, and North Carolina, who are on committees that have specific oversight of the legislation, this health care legislation that's going to go to the Senate. The Sunlight Foundation laid this stuff out. The Huffington Post went to the event, asked if they could gain entry for their $2,000. They were told, no, you can't come in. Meanwhile, I get an email from my brother. And one of my brothers, I have three brothers, from one of my brothers, this is my brother Steve. He says, I received an explanation of benefit payments from, and he gave me permission to tell you this story, from Blue Cross Blue Shield of Michigan, showing that they paid zero on an $81 billing from Metropolitan Hospital. The billing was for diagnostic tests, which turns out to be blood work ordered by my doctor. The reason I saw the doctor was that I had a severe reaction to a medication prescribed by a specialist I was seeing for sleep apnea. On the form, the explanation message says, we can't review this service because Blue Cross Blue Shield Michigan does not handle mental health and substance abuse claims for your group. So he calls him up and he says, wait a minute, this was a drug reaction to a prescription drug. What are you talking about, substance abuse? And they said a drug reaction is considered substance abuse and our health insurance company doesn't pay for it. And he said, so if I was allergic to penicillin and I was given penicillin and I went into anaphylactic shock and ended up in the hospital, you wouldn't cover that? And the person on the other end of the phone said, no, we would not cover that. That would be considered substance abuse. And then Steve puts together a list of, his time, the doctor's time, the billing time, the hospital time, the person he talked to on the phone, all of this. I mean, it's just absurd. We're spending all of this time. A large hospital in the United States can have as many as 300 people in its billing department. Single hospital. A large hospital in Canada will have 3. There's something fundamentally wrong with this system. And what's fundamentally wrong with the system tracks right back to these Republican senators and by the way, not an inconsiderable number of Democratic senators having fundraisers where they're inviting the health insurance industry in, they're inviting the pharmaceutical industry in, they're inviting the equipment manufacturers in, they're inviting the AMA in, they're saying, come on in. We got Harry and Louise ads running now they actually revived the original Harry and Louise, and they're paid for by pharma. Pharma is the lobbying agency for the big drug companies, America's pharmaceutical research companies, even though the research is mostly paid for by the National Institutes of Health, which is your tax dollars and mine. Pharma, the organization that Billy Towson, after he pushed through Medicare Part D that says that the government may not negotiate drug prices with pharmaceutical companies. It has to pay full retail on every single prescription in America that's paid for by Medicare, even though that's millions and millions of prescriptions. Pharma, which then hired Billy Townsend, in fact, he had to get a special exemption from, as I recall, Tom DeLay, or maybe it was Denny Hastert at the time. It was whoever was the Republican leadership in the House. He had to get a special exemption to leave his job, sort of Sarah Palin style, I guess, so that he could take this $1 million a year plus salary from pharma as their head lobbyist. This is the cancer at the, to use perhaps an appropriate pun or metaphor or whatever. This is the cancer at the core of our healthcare system. Profit. Natural monopolies that have to do with life, liberty, and the pursuit of happiness, that have to do with the commons. Natural monopolies. Things where a free market just doesn't frankly make sense, should be handled by we the people. That's why we created this government. And we essentially say that in the preamble to the Constitution. Natural monopoly. For example, if God forbid you had a heart attack tomorrow, are you going to, as you're laying there in pain, are you going to go through the phone book and call 5 different ambulance companies and find out who's cheapest? Are you going to call 15 different hospitals and find out what their pulmonary care units cost? Are you, come on. There's no possibility of a competitive market in healthcare except at the very fringes. Yes, you can have plastic surgeons competing. You can have, I would, argue probably orthopedic surgeons competing. So you can say, well, I got a hip that needs to be replaced. It can take 6 months. I can wait 6 months. So I'm going to shop around and find what I want. Arguably there's room for competition there. But primary care, which is a crime to be insured by for-profit companies, in all but one of the other 35 or 38 industrialized countries in the world. A crime. A small fact that was deleted from the special on this for public broadcasting that so enraged the producer he came on this program and said he had his name taken off it. It is a crime to provide primary health care at a profit. And in most of these countries, physicians work at a very good salary, but work at a salary, so they have an incentive to provide good services to people. They have job security. They can go to school for free in most of the developed countries of the world. And everybody gets it. This is a natural monopoly. As a natural monopoly, this is the appropriate province of we the people. And to have a so-called insurance agency say, I'm sorry, we're not going to pay the bill because it's related to substance abuse, when the substance abuse was taking a legal prescription drug prescribed by a doctor to which you happen to be allergic and you didn't know it until you took it. A is obscene. But B, even more obscene, is to simply say that we're not going to, a health insurance company isn't going to cover substance abuse. I consider substance abuse to be a medical problem. So what if Steve had actually been abusing drugs and had a medical problem as a consequence of that and went to the hospital? They're going to say, sorry, we don't cover that. What? I mean, this is how sick and twisted and dysfunctional our system is. People are dying. In the course of this program, about every 30 minutes in America, somebody is dying simply for lack of health insurance. And that doesn't cover the people who are insured, who are being wiped out by the lousy coverage that they have. Half of all bankruptcies are people who are insured when they got sick. How can we call ourselves a moral people when this is the situation we have in this country? How can Republicans and so-called moderate or conservative Democrats with a straight face and even the smallest shred of integrity say that, well, we need to take this slowly and carefully, when it was first proposed on a national stage in 1913 by Teddy Roosevelt, and it was first proposed to Congress in 1946 or 47, I think it was 47, by Harry Truman. Oh, we've only been working on it for a half a century. We can't rush. We can't hurry the process, Might have a bad result. The bottom line here is a single-payer healthcare system, whether it's administered at the federal level, as John Conyers' Bill H.R. 676, which I now have read and is complete and is brilliant, or whether it's state-administered, like Bernie Sanders' bill in the Senate, is the way to go. It's the very best way to go. But lacking that, let's get a good, solid public option so at least some of us can escape from the grips of these parasites that call themselves health insurance companies.